have spent a lot of time convincing the scientific and clinical community that the brain can recover and there is neuroplasticity. So now I'm focused on trying to answer the question, yes, we know there is neuroplasticity. Yes, therapy helps people, but do we know which therapy is perfect for the right person? Can we predict for each individual person, what's the right therapy for you? Should you be going to an intensive program for 6 months, like a boot camp, or should you be going to a club, a social club where you get practice? So that's what I'm focused on right now, is how can you predict or prescribe which therapy is perfect for the right person? And again, that takes a lot of data, but as I said, some of the tools we have available to us are brain imaging tools. So we're able to see very, very sophisticated and clear pictures of the brain. What part of the brain is damaged? What part of the brain is intact? How are the connections, as you pointed earlier, how are the connections intact and how are they affected? How is the brain connectivity set up? So we're using all that data about the brain to develop models to predict what would be the level of recovery someone's going to show. So just simple things like the more the damage a person's brain has and the less connections it can make, the less recovery we would probably show. But it's a bit more nuanced than that as well, because we're able to use these machine learning models to really make a precise guess at how people can expect to recover. So it's a prediction, it's a precision medicine prediction work. So that's one area of work that uses a lot of brain imaging data, which is hard to do, but we've been fortunate to get that data. The other, as I said, is to use AI and machine learning to take people's behavior and see if we could then also make better estimations of how much therapy somebody needs, what's the kind of dosage that somebody needs. Again, to come back to making policy decisions of don't waste somebody's time telling them that they can only get 1 day a week of therapy. It's never going to change their brain, or they're not going, if they want to go back to work, if they only receive 1 session of therapy every 3 weeks, it's a waste of resources and effort. So we're trying to, again, use machine learning and AI there because we have data now, which we did not have 10 years ago. We really didn't have the kind of data we have now to create these algorithms and predictors that say, here's what to expect. So I would say the work that I'm doing right now is a lot about trying to predict the future for individual patients.
Okay, I like that. Peer into the hourglass, into the glass ball, and see what the future is going to be. That's good because that offers hope.
Yeah.
And
Yeah.
if you can predict a positive future, you might not be 100% certain that that's a positive future for that person. But if you can offer hope towards that, they might prove you right. One of the interesting things is when you hear somebody gets 1 hour a week of speech therapy, it's almost like the system is proving themselves correct in saying that funding this particular thing is not going to get results because look at the data. We have people who have gone through the program, they really didn't get results. We shouldn't really fund this. We should put our funding somewhere else. It feels like the system previously was all about proving that recovery is not possible. It wasn't about going, let's get excited about the possibility of recovery. It was all about, we need to stop funding this because it's probably not going to happen.
Right. But Bill, I feel, I've been doing this for a long time, and there have been many years where we thought, is this even going to make a difference? But I feel optimistic now for 2 reasons. I feel like we're in an optimistic phase of this for 2 reasons. First of all, myself and many other researchers like myself in this field have access to a lot more data, sophisticated data, good data, and a lot of data. So we are able to make better conclusions about what's working and what's not working. That's one thing. The second thing, which I think is very important. And I'm curious to see if you have experienced this in Australia as well. But as you pointed out in the introduction, when you have a stroke and you can't communicate, it's extremely difficult and very socially isolating. So most people who have had a stroke and have aphasia stay home, don't get out, find themselves isolated and lonely and depressed. And until the pandemic, that was just the way those people lived. And only after the pandemic did people realize if you stay home all the time and don't talk to people and socialize, it can really affect your mental health and it can affect who you are. And so I feel like finally there's some acknowledgement of what it's like for someone to have a stroke and have trouble with communication and socialization, and why we need to do something about it. That's an awareness that's happened, I would say, in the last couple of years. And I'm very optimistic for that reason, because I think now the world knows what people with aphasia have faced all these years.